Good afternoon. My name is Crystal Gonzalez Fernandez, and I am currently a San Jose State University student. Today I will be introducing a health innovation that my fellow colleagues and I have developed. The title to this presentation is Health on Wheels. It will be presented by myself, Crystal Gonzalez Fernandez,
David Rodriguez,
Melissa Chu, Yuan Fang Huang,
Let's begin. In the introduction, I will give a brief overview of the following. A summary that includes a background, a description of the program service proposal, and a small insight into the personnel of the clinic. My colleagues will be elaborating on these topics further in the presentation. The background. Healthcare in the United States is not accessed equally by everyone. The elder population accesses healthcare services more often when being compared to other groups. It has become harder for elder people to access healthcare services, especially with the current healthcare system in place. Medicare is often denied in many private facilities, leaving elders to go to big community clinics, where their needs are not always met. To conclude this slide, the U.S. Census Bureau estimates that by the year 2050, the population aged 65 and older will increase up to 89 million. Malnutrition is defined as a condition that occurs when a person's diet doesn't contain the right amount of nutrients. It can mean an individual is not consuming enough protein or vegetables to meet the needs of the body. Often, elderly people need help and don't have access to support services that can help them in simple daily activities, such as cooking and grocery shopping. The program's intentions are to address the lack of access to care. The clinic will be providing healthcare screenings, providing healthcare assessments, and helping with end-of-life forms, such as physicians' orders for life-sustaining treatments, and 5-wish forms. The clinic would provide workshops for the patients to help understand the forms and their meanings. The second intention is to give healthy meals to elderly patients. After their visit with the clinic, the Health on Wheels clinic will have 2 parts to it. The mobile clinic will be staffed with physician's assistants, medical assistants, nurses, medical doctors, and receptionists. The clinic will be providing services that include healthcare visits, healthcare assessments, and workshops to help with forms. The mobile clinic will also have a soup kitchen that will have chefs, servers, tables, and chairs. The purpose of it would be providing more meals to patients after their visit. Now, David will be introducing more information on the background.
thank you. Thanks to the advances of medical technologies, humans are now living longer than ever before. Because more people are living longer, they will require greater access to resources for care. The senior population requires access to health services more than any other group in the United States. Many seniors and low-income families lack access to nearby health facilities and might not be able or might not be aware of the resources available to them. As a result, many experience poor health outcomes, and we, as a society, end up having many preventable deaths. These communities are often pushed aside because of their Medicare status, or simply cannot afford to care for themselves. Common issues seniors and low-income families face are malnutrition and routine checkups. Mobile clinics will provide accessible and affordable health services, which would improve the quality of life for these individuals. Our innovation will also address hunger issues many seniors and low-income families face by having on-site hot meal services. As health professionals, it is our duty to address the issue of unequal access to care and improve health outcomes. I will now pass it on to Melissa, who will speak about the program proposal.
Thank you, David. So our group is proposing a mobile health and food services program in San Jose, which serves older adults living in assisted living facilities and senior community centers. What makes our service unique is that we're combining 2 services into one program, a mobile health clinic with a mobile food truck. Our mobile health clinic would be made out of a recycled trailer or bus, which we would remodel to fit the needs of our program, such as adding a wheelchair ramp or railings to make it easier for older adults to enter the vehicle. The services we provide in our clinic would focus on prevention, So we would be providing basic health screenings and assessments, assistance with medical forms such as end-of-life forms, post, and 5-wish forms. We would also provide handouts with simple nutrition and physical activity tips that are especially geared towards seniors, as well as information on the signs and symptoms for diseases that are common in older adults, such as Alzheimer's and depression. We would also provide a call directory for services such as Alcoholics Anonymous, the Depression Hotline, and how to get help for older adult abuse. In addition to our mobile health clinic, we will also have a mobile food truck, which would offer free, nutritious, and tasty meals or snacks after our older adult visitors have finished at the health clinic. Our program would visit assisted living community centers every day of the week. We would first offer our services to facilities who need our program the most and then go from there. In terms of staffing, our mobile health clinic would need a driver who can also serve as a receptionist, a doctor, a nurse, a physician's assistant, and a medical assistant. Besides the staff that we will need to work in the mobile health clinic, we would also need someone to do outreach for our program. This person would coordinate and schedule our visits with the assisted living homes and senior living facilities, as well as promote our services a few days in advance so that our target population is aware of our program. For the food truck, we would need at a minimum 2 cooks, one for the day shift, one for the night shift. And along with all of our permanent staff, we would recruit volunteers from the community to help with the food truck and our mobile health clinic. In this way, we're not only engaging our older adults, but also the surrounding communities to participate and take part in our program. And now I'm going to pass it on to Yuan, who will talk about financing and the value of our program.
Hi, in terms of financings, to finance our projects, we need approximately $600,000 to get started. As you can see, we have a chart with the general breakdown. The highest cost will be both the mobile medical clinic and the food trucks and the equipment. The value of our program was based on ACEs: assets, cost, saving, efficiency, and sustainability. As a mobile services, we are providing easily accessible preventative care, including signs and symptom monitoring, healthcare screening, and healthy habit educations. Through our services, we are helping to reduce the risk for sudden health deteriorations from stroke and heart attacks, the necessity of tertiary care, and the cost of healthcare from overall perspective. Our food trucks and mobile health clinic will be cost-saving from solar panel installations and also the community donation as well. And our food truck will sell food for other population in the community. The revenue made from selling food will be used for paying the cost of our services and to maintain the function of our mobile clinic. In this way, our program is made more sustainable and efficient. And our medical professional will develop the appropriate protocols to help the mobile clinic practice in the scope of safety and also make the practice more efficient. All in all, our program is not only beneficial to our populations as it encourages a focus on disease prevention, but also improves the quality of life within the community by increasing population's awareness through the practice of healthy lifestyle. And now I'm going to pass it to Vivian for conclusion.
So in conclusion, our program Health on Wheels is to provide the opportunity for the older adult to receive medical benefits and prevent the malnutrition. As the older adult population continues to grow, the medical attention toward preventing disease has also increased. We target older adults in assisting living facilitating to better understand the determinant of their healthy lifestyle in older adult population. The mobile health clinic and food truck are working together and are beneficial to change older people behavior and help them make a healthy decision on a daily basis. For our mobile clinic, we have the basic health screening, healthcare service, and nutrition program to teach older people to gain their benefits and promote a healthy senior community. With this mobile clinic, we provide accurate health information to help older adults to understanding the importance of the healthcare service and health tips, and also to enhance the efficiencies of the information used. In addition, the food truck is to improve older people's nutrition knowledge and health promotion in the particular ways of the healthy habits and lifestyle. Therefore, our program, Health on Wheels, developed the mobile health clinic with food truck. Have advantage approach is essential to address the issues of the cost, efficiencies, sustainability, and access to a quality health care service, which it can provide care delivery, health information, and the prevention program to improve the quality of life and the value of care. It is an effective way to take a great action for improving the health function and the management of the malnutrition for supporting the older adult population. We want our program Health on Wheels to be success and serve to the senior community. Thank you.